So today we go to the class. We're talking about preventing Gua Sha Adverse Events. So that's still, we're still in the safety aspect. So now we're talking about Gua Sha. I think most students pretty familiar with Gua Sha already. So what means Gua Sha? Gua is kind of a scraping of the skin on the very superficial of the skin. We use Gua Sha tools to scrape it. Sha means after scraping, some redness kind of pitches show up. So that's basically is under the skin, some bleeding, small micro vein. It's called some bleeding there, but it happens under the skin, not truly above the skin. So that's generally Gua Sha. Yeah, that's generally Gua Sha. So that's the generally say introducing to Gua Sha. So Gua Sha, we say just use the Gua Sha tools, scraping of the skin. So Gua, Chinese word means scraping. Sha is some redness show up. So that's together we call Gua Sha. Gua Sha you can use for different part of the bodies. And we have different kind of Gua Sha tools. So these Gua Sha tools is very popular. You can see they have different shape. Basically, this big area, you can use a big part of the bodies, like the back.
Not right now, I'm in class.
And this part, you can see, like they have a dam here. This part is pretty good if you use.
Remember you said yesterday that there's balls. There's so much you can do, Dylan.
So this part is pretty good. It's still used on the back, but over the vertebrae. So we have bone in the center. It's a little bit bigger here. Then you put Gua Sha tools. Like this side, let's be deeper. This side, let's be deeper. But keep the bones, not too much pressure in here. And this side still used for big area. This side you can use for a small part of the body, like the arms. And also, like this part, yeah, any kind of angle part, you can use for like the points pressure there. So we say we Gua Sha scraping the skin, but truly we can use Gua Sha tools instead of like a finger pressure for the points. We also have special kind of Gua Sha tools, like this kind of shape. That's truly working very well for like a points pressure there. So that's the pretty popular Gua Sha tools like this. And we say we could go to Gua Sha to different part of the bodies. We have different kind of materials. We can go to different part of body, and they have different nitriles. So that's kind of stone. We call 扁石. Stone kind of Gua Sha tools. So that's the same one we talk about, the pretty popular one. We have ambers. Ambers working like more smoothly. You can go to the face, you can go to the body. They still have different shape. This part you still can over the spinal there. And the other part is more smoothly there. And we also have Judy one. So that's these two, both Judy one. The Judy one people more popular use for the face. They are cooler natural. So if we try to cooling down, Judy one is better. But if patient originally is cold natural already, like a cold body already, you better use another two kind of foam. And sometimes we have special kind of wood still can use for Gua Sha. So we have a lot of different kind of materials we can use for Gua Sha. So that's this one pretty good working for the face. It is more cooler and more smoothly. And also some people use this rolling kind of Gua Sha tools for the face also. Then we're talking about clinical applications for Gua Sha. What we use for Gua Sha? So Gua Sha is the way we strongly moving qi. So like on the radio, that's lady, they Gua Sha pretty harder. That's strongly moving qi way. And they also moving blood, reducing blood stasis. So when patients have qi stagnations, have blood stasis kind of conditions, they will have painful situation. So usually it happens in the muscular skeletal muscles there. Like pretty commonly, patient have pain on the leg. Generally, it's a painful situation. Painful could be happens on the leg, on the arm, or maybe on the back. So like any part of body, we can do Gua Sha. Help qi moving, help blood moving, and reducing painful situation. So that's basically working for local problems. Local stagnation caused painful locally. We use Gua Sha. Yeah, that means where you have painful situation, where you can go. Yeah, where you can go. And another big category here, we do treatment. We relieve external passenger evading. So that means EPI condition. We can use Gua Sha to relieve it. So EPI condition, like a patient have fever, chilled, running nose, headache, sometimes cough, short breath, So that's belong to respiratory symptoms illness for Western medicine. Generally, it's acute condition. It's not chronic condition. We can thinking about use Gua Sha. In these kind of situations, we mainly Gua Sha on the upper back area. So that's basically go to your bladder channel. Your bladder is food 太阳. So 太阳 channel go to most superficially of the body. So EPI evading usually attacking 太阳 channel. So like people have headache, especially on the occipital area, on the neck. So that's usually relieve external passenger evading with Gua Sha for 太阳 channel. And in that kind of condition, truly, we can see lot of Sha show up. It's dark red color. So that's basically clinically, we treat the problems. But certainly like the radio, if you try to like a local qi blood moving, you can still go to locally like the face. Gua Sha there, that's for like preventing illness and help the qi moving and keep the healthy condition. But treatment for illness, basically, we remove moving qi, reducing blood stasis. That's mainly for painful situation. And then we can working for EPIs. So that's generally clinical applications. So diagnosis of Sha. After we do Gua Sha, sometimes we have Sha show up. Sometimes no Sha show up. Sometimes the color of the Sha is more darker or clear. Sometimes the color of the Sha is not clear. So that's clinically we can use for diagnosis. Yeah, help us for diagnosis. So if patient normal condition, like we say, patient normal, after Gua Sha, maybe just locally, redness all over. Like the lady do Gua Sha on the face, the color just the redness all over. It's not truly Sha show up. So that's the normal condition. Yeah, that's normal condition. That's condition which is help qi blood moving on local area. Still good, but still not overdo it. Yeah. So you can see from the video, if the Sha show up, you just do a couple of the scratching. The Sha will be show up. If patient don't have illness condition, whatever you scratching there, Sha will be not show up. So now depending how long time you scratching there, depending patient's conditions. And we know we do Gua Sha for two kind of condition. One is local qi blood stasis condition. One is EPI evading condition. That's two situations for the treatment. we know the patient have maybe one of the conditions. Then we do Gua Sha. If take a pretty long time, then the Sha show up. Or maybe the Sha is a pale red color. Thus, basically, patient have underlying body condition, blood deficiency. So that color is lighter red color, and take a long term, the Sha show up. If patient's Sha color is dark red, like our second radio, dark red color on the local area, that usually is the heat condition. Sometimes we can see pupil color. Pupil color means blood stasis. So from the Sha color, we can get some basic diagnosis. And also, we're talking about the Sha. Also, we can, like from Sha, tell the patients, like how illness will be development, like a prognosis. So for the patient, after Gua Sha, how long time they can recover? If too long term to recover, that's basically chronic condition, and also happens under deficiency conditions. If short time to recover, generally say patient in acute condition, and the patient's body qi blood is pretty strong in there. So that's from the Sha, we can get some basic diagnosis idea. And also we can know that's the chronic condition or acute condition. From how long time the Sha will be disappeared. So usually, normally the Sha will be disappeared around 3 to 5 days. So how long is long? After 1 week, even close to 2 weeks, still some mark in there. So that's basically from Sha, we can tell the patient's conditions. So that's about the diagnosis part.
Sorry, you said 3 to 5 weeks to heal?
Usually 3 to 5 days.
Oh, days.
Not
Okay,
a
that
week.
makes more sense. I was like, that's a long time. Okay, thank
Yeah,
you.
not a week. Yeah, normally 3 to 5 days. If over a week or over 2 weeks, that's pretty long time for sure. Yeah. Normally about 3 to 5 days. Still depending like how severe the Sha show up, and also the patient's conditions. We say patient have deficiency condition, it's take more time to healing. Patient normally qi blood pretty strong, that's short time will be healing, but normally about 3 to 5 days. Yes, some people, their body qi very strong, maybe just second day, it disappeared. Yeah, still possible, but originally 3 to 5 days. Then we go back. We say Gua Sha, generally speaking, it's pretty safety, but we still be careful, or we have some contraindications when we do Gua Sha treatment. The first leg, pretty similar like cupping. When we're talking about cupping, we say cupping maybe make a mark for the patient, marks for the patient. And certainly Gua Sha, like the video we see, still make marks. And that kind of marks, depending patient's conditions, may be pretty dark, maybe pretty big area. So that's still before the treatment, we need very clear to explanations what will be happens. So some mark show up, that's we call Sha. That's the normal reaction of the Gua Sha. So explanation for the, like what will be happens if a patient never do Gua Sha before. We must be explanation clearly. Don't scare for the patient, like after a Gua Sha treatment. Then they see very, very dark red or even purple color, like over the body, on the back or other part of the body, will scare the people if they don't understand it. And also for our treatment, for safety treatment agreement, sign the agreement. So just in case, just in case. Explanation for the patient, then like they sign for agreement, agree to Gua Sha treatment. So that's generally for each of the patient, if they never do Gua Sha before, the first time to Gua Sha, we need pretty clear explanations, otherwise maybe cause the other troubles. Then we're talking about if a patient pretty familiar with Gua Sha or do Gua Sha many times already. So they know what will be happens. They understanding what will be happens. Then they come in for the treatment. That's the situation we need to pay attention. Firstly, we say, we are not use Gua Sha treat locally acute inflammation or injury. Like a patient just falling down and injure their ankle area. We are not Gua Sha locally there. So that kind of make some more like a swollen or painful in the local area. So that's the first that we need to pay attention. Don't treat for acute inflammation kind of injury situations, like swollen there, redness there, and painful there. We are not directly Gua Sha there. Then we need watching local skin. Yeah, we need watching local skin. If skin have some injury there, like a sun burning there, we are not Gua Sha over it. Skin rash, we are not Gua Sha over it. Or any kind of injury on the local skin there, we are not Gua Sha over it. And if patient like coming for Gua Sha treatment, like 2 days ago or 3 days ago, and we got pretty good Sha in there, then patient coming again for the treatment. But that Sha not healing yet. It's not like the old mark there. They still kind of runny, swollen there. We are not over it. And the same situation, if patient do cupping couple days ago, and the mark still not healing yet, still like a flashing red mark there. It's not just slightly dark mark, old mark there is okay. But if flashing red mark there, we are not do Gua Sha there. So that's basically local skin. If they have any kind of issues, damage local skin, we are not do Gua Sha there. So like we are not truly do cupping and Gua Sha on the same location the same day, because either one, they will make a mark. We are not cupping over the Gua Sha mark. We are not Gua Sha over the cupping mark. So that's if some mark still in there, still in there, kind of skin injury in there. We can separate day to do it, but still waiting it more than 80% is healing. It's some slightly mark in there, it's okay. Yeah. But not like a red flashing mark in there. So that's we're talking about. And also we say when we do Gua Sha, try not over big artery. Like on the neck area, we have big artery, stomach line in there. If you Gua Sha there, you're slightly scratching there, not over scratching there. So that big artery may be caused like for some special condition, patient may be caused like some bluster more severe there. And also back area, we have a special receptor in there. That kind of receptor, they receive the information from the blood, like blood oxygen level, like blood pressure level. So even we couldn't pushing too hard on the neck area. Sometimes even if we're pushing too hard in the neck area, maybe cause the blood levels like up and down, not stable there. So neck area, let's be careful. But I know some people truly do neck area for the lymph, for the lymph. Just not pushing too hard on the neck area. Then we're talking about for pregnancy. So patient pregnancy. When we're talking about acupuncture before, we have some special points we say we couldn't use for pregnancy, like LFO, like stomach spring 6, like stomach 12, and your bladder 60, and the gallbladder 21. These few points we must be remember. Yeah, must be remember. Patient coming with pregnancy, these points we couldn't do for the patient. Too stronger moving qi, moving blood, maybe cause the like a miscarriage. Even other points, we say not belong to contraindication for pregnancy, but we are still not stronger stimulation the needles. And also we have two areas we couldn't acupuncture for pregnancy women. Sacrum area and abdominal area. Same idea, yeah, same idea. We couldn't Gua Sha in that area also. Yeah, no Gua Sha, no needles, acupuncture. And no cupping. So that's for pregnancy, remember. We finish contraindications. What kind of condition we couldn't do Gua Sha for the patients. So basically acute inflammations, injury in there. We are not directly Gua Sha in there. And like locally, any kind of skin damage, we couldn't Gua Sha there. And also like local severe kind of edema, still not good for Gua Sha. So that's belong to some skin damaged. And also for pregnancy patients, we have two special areas we couldn't Gua Sha, lower back and abdominal area. Similar like our acupuncture. Yeah, no acupuncture, no Gua Sha, no cupping on the sacrum area, abdominal area for pregnancy. So that's the contraindication. Diagnosis of Gua Sha we finished already. Yeah, we're talking about from the color. We can know some special condition of the patients. Maybe some blood stasis, dark pupil color. Maybe deficiency, just light color there. We also can through the Gua Sha tell the like how illness development, like the Gua Sha mark take long-term healing. That's basically chronic condition or deficiency condition. If the Gua Sha mark is easily to healing, that's the acute condition. Or patient body generally Qi blood is strong condition, no deficiency condition. So that's the diagnosis part. Then we're talking about the safety guiding line for Gua Sha. What we need, be careful for safety to do Gua Sha. So standard, yes, standard we need to follow. So we're still talking about the follow safety guiding line generally. Like we talking about do acupuncture before, do cupping before. Firstly, we need to set up a clear field area. So we say that's some small place. We can put a paper towel in there and put everything we need in that area. Like a package kind of needles and the Gua Sha tools, cotton balls. So that's the set up the clear field area. Another things I like to say. So Gua Sha and acupuncture. Acupuncture with Gua Sha. And Gua Sha with cupping we talked about already. Not in the same area, in the same day. But how about Gua Sha with acupuncture? If you do Gua Sha first, if you do Gua Sha first, if patient truly have lot of Sha show up, you are not put the needles later. If you do acupuncture first, after we start the needles, you're still able to do Gua Sha. But if you Gua Sha first, not truly Sha show up, nothing in there, you still can do needles. So that's truly depending different patient's condition. If they Sha truly lot of Sha in there, don't put the needles. All right, yeah. So that's you are able to do Gua Sha with acupuncture together, but not Gua Sha with cupping. Yeah, because Gua Sha make marks for sure. Cupping make marks also. So that's we say set up a clear field air and hand sanitizer. That's we talked about already. You can use like running water to washing your hand, 6 steps. I think you still remember there. And hand sanitizer to get hand hydrogen still okay, still 6 steps there. So make sure your hand is clear. And also before Gua Sha, we need to ask patients history. Especially focus like what kind of medication they use. Like if patient truly use some blood thinner kind of medication, that's basically this kind of patient is easily bleeding. Or maybe patient tell us they are pretty easy got a boost. That kind of condition. They have blood circulation system, some disorder. That kind of patient, we still can do Gua Sha, but pretty slightly, not too heavy. If too heavy, cause like more bruised under the skin, that's cause more painful situation. So slightly Gua Sha, or maybe we choose other treatment. So that's we need to pay attention. And also some patients, like a cancer kind of patient, they need a chemotherapy. Chemotherapy basically use medication specially treat for the cancer. So chemotherapy, that kind of medication basically is pretty severe damage body zhengqi. It kills the cancer cells, but at the same time, they kill some normal body cells. Yeah. So that kind of patient generally say is kind of weaker. Or Gua Sha is more moving qi, moving blood. Patient is weaker already. So we try not like moving qi, moving blood too much. So that kind of patient, basically, if we do Gua Sha 48 hours before, like a patient, the day after tomorrow, they try to do chemotherapy. They will be scheduled. They will know. Yeah, they will schedule. They will know. So like we do Gua Sha yesterday. Yeah. So we gave more space. Yeah, at least 48 hours, but we try to give more space there. So that's before, before chemotherapy. And after, after patient finish chemotherapy already, after 24 hours, at least 1 day, at least 1 day. So that kind of space help the patient healing, help the patient healing. But generally speaking, chemotherapy kind of patient, like a cancer kind of patient, they will have different kind of deficiency. Gua Sha is not truly treat for deficiency kind of condition. We say we just treat the EPI condition, treat the local Qi blood stasis condition. So that kind of patient may not necessarily need Gua Sha treatment if we try to todify. Yeah. But if they have some blocking locally, we still can use Gua Sha. Just pay attention to time space there. So that's for chemotherapy kind of patient. So that's for safety. Yeah, that's for safety. It is better when we do Gua Sha. So Gua Sha Tools, yeah, Gua Sha Tools. Basically, mostly we will be reused. We will not just use once, then we dispose. Yeah, certainly, if some Gua Sha tools, like sometimes, like at home, we are not truly Gua Sha tools. We use spoon. We do Gua Sha, then we just throw away. Yeah, but now people truly throw away the Gua Sha tools. So after use, certainly we need pretty clear to washing and disinfecting. Yeah, if we reused. Yeah, we can reuse the Gua Sha tool for sure. Yeah, it's not like a needle. A needle go to inside the body, but a Gua Sha tool is on the superficial of the skin. But it's better if at your home, it's better. Like each person, they have their separate Gua Sha tools. Yeah, it's better. But clinically, little bit harder. Yeah. So clear got disinfections. 70% alcohol will be working. Yeah, washing the Gua Sha, like after you treat one patient, and washing the Gua Sha tools with soap, and then use like 70% alcohol to clear it. So if we talk about skin not broken, yeah, no blood on it, yeah. Certainly, if some blood go to the Gua Sha tools, we still follow, we talked about before, like a copy. We need washing it first, and then soak to the bleach. Yeah, bleach is more stronger compared with alcohol. Yeah. So that's basically we need very good disinfectant, just in case transform passenger from one person to another person. And also we talking about superficial body skin, the patient's skin will be clear, not Gua Sha over the dirty skin. Yeah. We talking about Gua Sha itself. We are not truly necessary use like alcohol to clear locally. We just put some oil there, and then we can Gua Sha it. But truly, if patient coming, they just after labor work, pretty dirty local area, maybe we still better with some alcohol to clear locally. Then waiting alcohol dry, then we put some oil, then we Gua Sha locally. So that's be careful. Not Gua Sha over the dirty skin. That's some passenger maybe go inside. And then we talking about already, like some skin rashings, like skin damaged, inflammation locally there, or some broken skin, like some injury or cut in the skin area, sunburning, and other way of burning kind of skin. Right swollen there, we are not Gua Sha. Yeah. So that's for our safety way. We're talking about some conditions, we are not Gua Sha. So that's the ruler we must be follow. Yeah, that's the ruler we must be follow. Some condition we couldn't do Gua Sha. Then stronger recommend. So Gua Sha we can do for children. Yeah, we can do for children. But we know Gua Sha will make some mark. Similar like a cupping. If you make some mark on the skin, that's maybe thinking about like people do something injured children. Yeah. So in that kind of condition, we need like parents coming and watching what we do. We're not truly injured there. Yeah. So that's basically for children. And truly sometimes Gua Sha mark look like a pretty severe kind of injury, but not truly like a painful there. Yeah. I think a few years ago, there's a story like the firm, they make a story about Gua Sha in United States. They talk about like a grandmother do Gua Sha for their grandson. You heard about that time we talk about, yeah. So that's kind of situation. We pretty be careful, yeah, pretty be careful. So that's basically for children. We are not say we are not totally don't do for children, but be careful. Even you do like in your home for your children, be careful talking with their like teacher or kindergarten or whatever, what you do for your children. Yeah. Otherwise, they may thinking about, yes, right, yeah. So that's for children, yeah. It's pretty good treatment for children actually, compared with needles. It's not truly painful. Easily accepted. Yeah, and easily, yeah. But just be careful, sometimes we need to protect it over ourselves. Then recommend. So that's basically we talking about already. So basically before do Gua Sha with explanations, what will be happens? Yeah, what will be happens? Especially patient first time for Gua Sha. Yeah, first time for Gua Sha. Never do Gua Sha before. And tell them what will be happens. And also when you do Gua Sha, not overdo it. Yeah, not overdo it. The first video, the lady, they do pretty deeper because they generally say the healthy condition. Even they do pretty deeper, still no sha show up. But clinical treatment, maybe you just small Gua Sha there, couple scratching there, and the sha show up already. So basically, if sha show up, you can continue a few times to see if they still have more sha show up. If a few times later, no new sha show up, you can stop and changing another location. Yeah, not like a too deep pressure and over time do the same location. That's still possible damage the skin. So that's basically you need watching the skin reactions to sha. That's like I say, if a patient have a passenger kind of condition, just a couple scratching, survey will show up. If they don't have that condition, whatever, you deeper scratching there, no such up. So that's not overdo it, not overdo it. Gua Sha treatment, we can use for different part of the body treatment. We can treat the shoulder problems. We can treat like lower back problems. We can treat like arms problems, legs problems. We can treat a lot of conditions. And the different kind of conditions, we need to control how deeper we use Gua Sha. So we can see Gua Sha right now are more and more popular. Even some massage therapists, they use Gua Sha also. Yeah. Or originally just TCM practitioner, we use Gua Sha. So now a lot of other therapists, they still use Gua Sha. So truly for us, we still can combination Gua Sha with massage. We still have massage, clean-up massage. Yeah. So that's mainly we use for local stagnation, painful situation. But if we use for relieve passengers, yeah, we are not necessary combination with the massage. Yeah, totally depending what kind of conditions we use Gua Sha. So basically treatment sections is around 10 minutes. Yeah, around 10 minutes, like just Gua Sha. Yeah, just Gua Sha. But you can combination with other treatment. Like we say, you can combination with acupuncture. If you combination with cupping, different location, still okay. Yeah, not the same location. We say we are not do Gua Sha and cupping same day means the same location, but separate location still okay. Yeah, still okay. So that's for Gua Sha combination with other treatment. Then we talking about after Gua Sha. Yeah, after Gua Sha, how we deal with the Gua Sha tools. We say Gua Sha tools, yeah, is not exactly same like needles. Needles, which is one time use, we are not reuse the needles. But truly Gua Sha tools similar like a copy. Yeah, similar like a copy. The cups, yeah, similar like the cups. It is reusable. It is reusable. Certainly, if you like changing the Gua Sha tools each time, still okay. That's perfect. But most clinically, we will reuse. When we reuse the Gua Sha tools, that means we need a pretty good disinfections. Otherwise, still possible transmit illness, even over the skin. We say normally some passengers just living on the superficial of the skin, normally, like no more flora in there. Yeah. Bacterial and virus and fungus that they will living in our superficial skin. But they are not caused the illness normally because our skin belong to part of our immunity systems. They can preventing like a passenger go inside the skin and cause the inflammations. So the herpes skin issue, mainly the skin is injured or damaged. That kind of situations, then will easily cause the like injury or inflammation. So that's we talking about if skin not injured. Yeah, if skin not injured. We're working for that kind of skin with Gua Sha tools. That kind of Gua Sha tools we can think about. It's not that severe kind of conditions. We can reusable. So that's basically belong to no critical kind of environments or tools, including the cup, yeah, including the Gua Sha tools we use on the healthy skin. That's we all belong to like a reusable kind of like tools in there. So these kind of material, yeah, this kind of material, if we belong to there, whatever we used, yeah, Gua Sha tools or even balls you use for Gua Sha, generally say we just clear it, yeah, we just washing it. Basically, we're talking about before Gua Sha, we may put some oil on the skin. So after Gua Sha, the oil will be on the Gua Sha tools. And we need to wash it with the salt and the water. And then we can just use some like 70% alcohol and maybe hand sanitizer. They have alcohol inside and wrapping it and make it dry. Yeah, that's a pretty easily way we clear these kind of Gua Sha tools. So that's belong to intermediate level disinfectors. So we still follow like introduction on it, how we can use it, like how long time we use it. So that's basically we can use it. It's not that severe kind of condition. We transmit illness from one person to another person. After we wash it, we can running it with the water and then dry it with the like a paper towel and put on the clear air and some closed container like good protections. So that's most case, yeah, most case after Gua Sha, which is washing with soap and water, and then we can put some alcohol, 70% alcohol, or maybe hand sanitizer, then dry it, yeah, and then put it there. That's for most case, yeah, most case, and you can use for another people. So that's generally we use this way. And then we're talking about if we use the Gua Sha tools over some skin, it's kind of damaged kind of skin there. We say we are not truly directly use Gua Sha over the damaged skin. But maybe during your Gua Sha, you are a little bit hard scratching there and cause some blood coming out. That kind of skin, we think about is damaged skin there. Yeah. So that kind of conditions, we're thinking about the semi-critical kind of Gua Sha tools in there. Yeah, it's a little bit more dangerous situation. It's not that too dangerous, but truly touching body fluid, touching kind of blood in there. Yeah, skin is broken in there. So this kind of case, this kind of case, we need a more clear, more way to clear it. So basically, we're still washing it with the salt and the water. We need to remove the oil first. Most case, when we do like a gua sha, we better put some oil there first. But when you do gua sha, try not too oily. If you make too oily, local air, it's pretty oily. It's not that good. But a little bit oil in there will be good. Similar like we do cupping. Cupping. Before the cupping, fixed cupping, fair fixed part cupping, you are not necessarily put oil. But if you try to move the cups, you still need some oil there. But still not too oily. Still not, just like local air is like pretty easily moving, will be good. So that's basically most case. Before gua sha, before cupping, we may put some oil there. So then we're talking about if we gua sha, kind of small skin damage there. Then we still washing it by the salt and the water. We remove the oil first. And then now we need to follow some high level kind of disinfectors. So still follow instructions on the label. So that's basically clinically, like we can thinking about like bleach. Bleach is belong to high level disinfectors. So when we're talking about if we use not connection kind of skin, like a damaged kind of skin, we are not only running it with the water. So basically, we need more clear water to run it, or maybe with some like disinfectants in there. And after rinsing, then dry. So basically, I will suggest you just put the inside bleach, a few hours, and then you run it. That will be kill all the pathogens. That's the easy way. That's the easy way. It's not like a cupping, glass kind of cupping. After you washing, you can put it on the oven. But Gua Sha Tools mostly made is couldn't healing kind of material. Most Gua Sha Tools couldn't healing. So bleach and it's easy way we are easily get it and easily use it. Soak for the bleach for a few hours, then take it out and then dry it, and then put it there. So that's basically still pretty safety way. So whatever we do, safety first. Acupuncture, Gua Sha, Eastern medicine, cupping, bleeding, all the way safety first. So that's for disinfection the Gua Sha tools. Then we still have safety guideline here for disinfection the Gua Sha tools. So basically pretty similar. Basically pretty similar. Clear all the tools and clear all the oil there, and maybe some other material in there. Truly, we are not truly use other like biology kind of material. What I thinking? Oh, sometimes maybe patient put some, people put some cream there. Cream and oil. Both good for the Gua Sha. If you have oil, you can put some oil. If you don't have oil, you can put some cream. Yeah. But whatever you put in there after you use, you need to wash it first, then go to disinfection process. Yeah. So remove everything you put in there. So that's the first step. Yeah, first step. So basically you clear the oil, salt, and water. The second step, disinfections. Yeah, disinfections. So that's be like including different kind of skin. If skin not damaged, you can just go to middle level. Yeah, middle level kind of disinfectant. If skin kind of damaged, you go to high level kind of disinfectants. So that's the second step. Yeah, second step. So basically still follow like what the instructions like on the bottle. Usually they have instruction how to use it. And also pay attention, protect it over yourself. When you clear the Gua Sha tools, including the cupping, with gloves in there, yeah, with gloves in there. If necessary, sometimes you can put some special kind of glass, protect your eyes. Yeah, some disinfectors, they may easily go to the eyes and damage. So that's just protected of yourself. Yeah, not only protected for the patient, also protected of ourselves. So that's some safety line we need to follow. Yeah, standard safety line we need to follow. Then we're talking about the stronger recommend. So still same thing. We follow the instructions. Then we got the disinfection, all the Gua Sha tools we use. I think when you practice in your clinic, try to prepare a few Gua Sha tools in there. Yeah.